Hello everyone, it's Dr. Yazdani here. Today it's all about chest pain, one of the commonest causes of attendance in the emergency departments around the world. This video is intended for viewers with a background in health or medicine. If you have chest pain, call your local helpline or emergency services. Today I will whiz through the commonest causes of chest pain without getting into the details and diagnostics. A heart attack, otherwise known as the acute coronary syndrome, ACS, is one of the commonest causes of chest pain. Remember, even patients with a normal troponin level and normal ECG can have the acute coronary syndrome and may require urgent intervention. When it comes to the acute coronary syndrome, a good history is everything. Cardiac pain or angina is usually described as crushing, pressurizing, constricting, or squeezing, and there may be radiation to the right or left arms or the jaw. The patient may be feeling short of breath and clammy at the same time. Aortic dissection is another life-threatening cause of chest pain. This happens when a pathology affecting the innermost layer of the aorta allows the blood to flow between the layers of the aortic wall, forcing the layers apart. In most cases, it is associated with a sudden onset of severe chest or back pain or both. It may be described as tearing in character, but not always. Mistaking aortic dissection for a heart attack could have dire consequences. Pulmonary embolism is a lung-related cause of chest pain. The pain of pulmonary embolism, or PE, is usually described as sharp or stabbing. It is inspiratory, meaning it is produced by deep breathing. This is called pleuritic chest pain. The patients may present with shortness of breath, but not always. In some, the first presentation is a collapse. They're usually tachycardic, and despite taking deep breaths, their oxygen pressure on the arterial blood gas does not increase proportionately. They may even be febrile. This may confuse an inexperienced doctor who may then think that they're dealing with a chest infection. If a pulmonary embolus is not treated on time, it could lead to a pulmonary infarct, a dead or necrotic piece of lung, which then triggers an inflammatory response, fever, and of course pain. Pneumothorax is another cause of a painful chest. It happens when air leaks into the space between your lung and the chest wall, causing the lung to collapse. Tension pneumothorax is a life-threatening form of pneumothorax in which the air trapped around the collapsed lung pushes the heart and its vessels in the opposite direction. There is no time to get a chest X-ray. If you don't decompress it promptly, the patient will die. Hemothorax, or accumulation of blood in the pleural cavity, the space between the chest wall and the lung, could also be painful. Trauma is not the only cause of hemothorax. Sometimes an intercostal artery will start bleeding and cause hemothorax and chest pain. This is called spontaneous hemothorax. Getting a chest X-ray is important and can save your patient's life. Pericarditis, the inflammation of layers around your heart, could also cause chest pain, which is usually sharp and may be worsened by deep breathing or lying flat. Inflammation of the membranes covering your lungs, on the other hand, is called pleurisy. It is associated with chest pain on deep breathing. Pleurisy may follow on from a simple chest infection. Chest infections or pneumonias can also cause pain, which may be constant or worse on breathing and coughing. Pneumonias affecting the lower segments of the lungs can even mimic abdominal pain and confuse the doctor. Likewise, some abdominal pathologies could be misinterpreted by the patient as chest pain, like pains from gallstones. Pancreatitis, another abdominal pathology, may also cause pain, which some patients describe as chest pain. It usually radiates to the back. Spasms of the esophagus, the food pipe, can cause sudden, severe chest pains that last from a few minutes to a few hours. These may be mistaken for angina or heart pain, especially because they're made better by GTN spray. Rib fractures can be very painful, but there's usually a history of trauma, in which case getting a chest X-ray is important. Not to look for broken ribs, but to exclude pneumothorax or hemothorax secondary to trauma. Inflammation of the cartilaginous extensions of the ribs is called costochondritis, which is also painful. This pain is usually reproducible by applying pressure to the affected area. Sore muscles, like after starting a new form of exercise, can also cause chest wall pain, but they won't kill you. Chest pain can also be caused by panic attacks. Some patients interpret the sensation of rapid heartbeats as pain. They may even have other symptoms like dizziness, nausea, and sweating. And last, but certainly not least in this episode, shingles can cause terrible chest wall pain. That's why it's important to inspect the chest of anyone complaining of chest pain. Shingles is caused by reactivation of the chickenpox virus and can produce pain and a band of blisters around your chest wall, which usually does not cross the midline. If treated early, you might be able to avoid the so-called post-herpetic pains, which are also awful. I will not talk about Prinzmetal's angina, which is a temporary spasm of the coronary arteries, but it looks like I just did. Anyways, stay safe and seek professional help if you ever have chest pain. Thank you for watching.